It's just really hard to know when either you or somebody you love is struggling. Let's talk about mental health for just a moment. We know that anxiety and depression rates are through the roof, and this week in particular is Suicide Prevention and Awareness Week. Here's what I'm so worried about. We know that more and more people are committing suicide. The numbers of anxiety and depression continue to go up. And in fact, anxiety is the #1 mental health illness, and it is female dominant. I am so concerned about this, and I really want to make sure we understand all the pieces of mental health. Again, it's not a one-size-fits-all. It's not a take this and see you in 5. It's really something that we've got to dig in, understand, and find solutions for. That's why a holistic approach to this really makes a difference. It makes a difference for the long haul. One of the key things that I think gets missed over and over again is that there is chemistry to mental health issues. So much so that we do test it in practice. In fact, we know that things like hormone imbalances, nutrient deficiencies, chronic inflammation, chronic disease, all impact mental health. So many women and men are given a medication for anxiety or depression, but they really have an issue with their hormones. They might be low in progesterone, low in testosterone, or they might have chronic deficiencies that just change the way the entire brain works. That's something that we've got to start paying attention to. Being low in B vitamins, being low in iron, being low in vitamin D, low in omega-3 fatty acids, all of these things, including being low in magnesium, play a role in mental health. There's a gut-brain connection. If you don't have good gut health, it's going to affect how the brain works and vice versa. So that's important as well. And then I think a piece of the puzzle that often gets missed because it's so hard to figure out is the role of trauma in mental health. Many people have been through things that are horrific, that are unspeakable, and the body keeps a score. It stores those memories, it stores those emotions. It may even pass those emotions down generation after generation. But we've got to address that, and band-aiding it with medication is simply not the answer. It may help, but it's not the answer. So we have to understand the role of trauma and what somebody has been through spiritually and emotionally as well. Again, the body's all connected. I often talk about the multiple layers. We have an energetic plane, we have an emotional plane, we have a spiritual plane, and then we kind of get to this physical plane. And we have to treat all 3, all 4, to really get somebody healthy. So this week in particular, and always, we should be thinking about all the pieces of mental health. And we should be working to really test and understand chemistry, to understand the emotions, to understand the trauma that a particular patient may have been through. We know that mental health numbers are on the rise, and we know that families and communities, we all want to help each other. But so often, it's just really hard to know when either you or somebody you love is struggling. I know all of you have been in that position, but we've got to make it easier to recognize when we're getting in trouble. Here are some easy signs and symptoms that may help. First of all, if you're withdrawing, if you're isolating from people you love and from activities that you love and you know usually bring you joy, that is a sign that you may be having either more anxiety or depression or slipping into that dark black hole. If your eating habits are changing, your sleeping habits are changing, those are additional signs as well. And most of all, if you're having trouble focusing and concentrating, you can't get your work done, you can't get a task done, oftentimes those are signs of ongoing anxiety and depression as well. All of these things are to be taken seriously. And again, we don't have to wait until you have a panic attack, a depressive episode. All of these tiny shifts and changes is the way the body is trying to speak to you. So be observant, really pay attention, and pay attention to the people you love as well, because they may be crying out for help without really asking for help, but just waiting for someone to reach out their hand. So if you're out there and you're suffering from a mental health issue, please get help. Work with the doctor who can help you understand how all the pieces fit together, and understand that if you're sliding into a black hole where you're even thinking remotely about taking your life, There are so many reasons you might be feeling that way, but you have to get help. Reach out to someone that you love so they can help guide you through the journey of getting yourself back to you.